call this meeting to order. The time is 3:32 p.m. Let me read what I have to read. I should have it memorized. This meeting is being recorded by the Greenfield Unhoused Community Ad Hoc Committee. If any other persons present are doing the same, you must notify the chairperson at this time. So first we'll do a roll call of members. We have Councillor Sarah Brown present, Christy Allen not present, Larry Thomas present, Reese McGovern present, Robin Green
Present.
And Officer Zoe Smith is not feeling well and unable to make it today. But we still have a quorum. We have 4, which is great. And if our guests want to introduce themselves, we can start with you.
Sure. Sarah Hearn, Chair of the Opioid Use and Prevention Commission and the Volunteer Coordinator for the Warming Center for the City of Greenfield.
Pamela McBride, Greenfield Public Library.
Thank you. Awesome. Well, first we will approve our minutes from September 11th and October 30th. Can I have a motion to approve the minutes?
Motion to approve.
And
I second.
perfect. Any comments or amendments on those minutes? Okay, seeing none, we'll do a roll call vote because somebody's remote. Sarah here present or whatever, aye. Larry, aye. Reese,
Aye.
Aye.
perfect. The minutes are approved. And then now we'll do public comment, but we don't really have members of the public unless Councillor Perry, you'd like to share anything on public comment? Yes. Well, if anyone joins later, feel free to let me know. And then for now, we'll go into announcements. So first announcement isn't really something that will happen, but something that just did happen, which is that Larry was honored at the Human Rights Commission, and that was really sweet. And Sarah gave a beautiful speech, as did Zoe, and so did Deborah McLaughlin. That was great.
Thank you all for showing up for that. I really appreciate your support. That's not something I normally would do.
That's
We're
glad that you did, Larry.
That's not something I would do. I ran out the door because that's not something I do, but I appreciate it. Thank you.
And we have a comment from Wid in the chat, just because he's not able to join audio right now, saying that he's at Tire Warehouse with a flat, so maybe in and out.
Good luck.
Yes, good luck.
All right. Anyone else have something they want to share that's going on? All right. What's that? So now we can get into our recommendations. And this is, last I told you guys it was 42 slides, now it's 46. So don't leave me alone with it. So it's really like it can grow forever, and then maybe we can reel it back in also. But luckily for Monday, we're literally the only thing on the agenda, so I don't think they're going to rush us, but also, you know, attention spans and how much people can absorb. So we could reel it in a little as well. But I'm going to screen share if that's okay for that. I think since I'm in the Zoom, if you want to like make me co-host, I think, so then I can screen share. Also, I don't know why I can't rename myself, but it's embarrassing.
Just pretend it doesn't mean that.
Oh, wait, I just share my screen.
Now you should be able to do
Okay,
great
great.
things as well.
Let's go. Okay, so here we go. Oh, wait. Can everybody on Zoom see my screen? Okay, great. So maybe I was thinking for format that we might just want to start clicking through the slides and thinking about talking points for each slide and who wants to say what. And then also some of the recommendations we didn't fully flesh out, unfortunately, in the committee yet. So maybe some of them we could also try to think through more if they're not totally buttoned up. And also just to like set expectations. I think Monday is like a good draft and we're getting feedback, but nothing's like baked until we bring forward like legislation text to the council or really put something like formal. So I think we're still just in like a starting to express our recommendations, but like we don't have it. It doesn't need to be perfect and it will never be perfect. So can carry on. And then we three worked on it. And we're not a quorum and that was totally fine. So, but if you all want to also share as we're going, like, I don't know, what do you think would be a good format for these, going through this?
Yeah, I mean, maybe we could just go slide by slide and talk about who wants to talk during which slides. Does that sound okay?
Yeah, if we could sort of do like a summary through, not a read through, but a summary through. Like, I'm going to talk about this slide and here's what it says.
Yeah, that sounds great. Like who's going to hold the different pieces?
Yeah. So
Okay.
Sarah, I think that you should be our introducer.
Yeah, that makes sense. So I can start with this part. I'll start with this part. Like, this is what we're going to go through, who the committee is, our challenges and findings, recommendations, and next steps. So who the committee is, these are the members. And I think we had this bubble because
It's our guiding question.
our guiding question is like, what can we actually do? Like not in an empowered way and not just, yeah. So some of the input we've had, a lot of input from everybody. And then the guiding principles, I feel like Reese, this might be a good one for you.
Yeah, I'm happy to talk about this one. So I'll talk about this one and then I think it goes into the survey, so that works well.
Oh, it does? Okay. I can't remember what happens next.
Yeah,
Oh, it goes into
Because
the
it goes
point in
into
time
point in
count.
time.
Okay, perfect.
which I can talk about this if you'd like me to.
That seems great if you would
Okay.
like to.
Yeah. It's, I mean, basically what's on the slide is what is there, right?
Great.
Yeah, so point in time count for Western Mass across the 3 counties. With an upward trend, and then the next slide is the point in time count for Franklin County and Greenfield specifically, so comparing the numbers, basically saying that the large majority of the point in time count numbers for Franklin County are in Greenfield, which, you know, we're the county seat, and so that both makes sense and also puts on us the onus of addressing this problem.
Mhm. Also, I'm thinking that Larry, you might be a good
So
person for this.
I can talk. So yeah, I could talk about this slide right here.
Yeah, that's what I was thinking, because you are the reason that we have the point in time count.
Yeah. Yeah, I can. Well, I'm the. Yeah, they've been chasing me down today. Yeah, I gotta. I gotta do it for the winter time too. So yes, I'll talk about this slide.
That'd be amazing.
Larry, would it be helpful for you if I adjust this chart to add the specific numbers on each bar or each column?
Well, I can see the numbers, but I mean, you put the numbers on if you want. I mean, I
Okay.
can follow what you got for that. If I see.
Yeah, I mean, it's the point of the slide is the big picture, not necessarily the specific numbers, but if you want, I can add them.
Yeah, I don't need the. I'm definitely talking about the big picture, so I don't really need the numbers.
Okay,
Thank
great.
you.
Yep, thanks.
Yeah, just like how it's actually an undercount.
Yeah,
Yeah, I'm
right.
gonna talk
This
about
is also
all
another.
that. All that's
Right.
gonna come up.
Thank you.
Mhm.
All right. Does that feel good on that?
Yeah.
This I just updated this morning to like the status of shelters in Greenfield. I mean, Sarah, you're not on the committee officially, but I'm like, it would be great if you wanted to talk about the warming center. But
I could, I mean, you could just identify that I'm not officially part of the committee.
Yeah.
I'd be happy to talk about the warming center.
yeah. there anyone else who feels like this slide? I don't know. Seems like
I'm happy to talk about these. I mean, I don't know as much as most people, but I'm here in and out of these all the time, so
yeah,
yeah, I'm happy to take this slide.
because I don't know if you'll be here on Monday evening is when we're presenting to.
Oh, yeah,
It's
that's the
open.
commission meeting. Well, what time is
Yeah,
the?
It's at 6 p.m.
It could also make sense for Larry to talk
Oh, yeah,
about
that's
this,
true.
since
I'm
you're gonna be
very,
the
very
previous
interested.
slide.
You're presenting
I'm
it to
very-
council?
Yes.
Community Relations Subcommittee.
Oh, okay, thank you. Sorry, Larry.
I'm
What were you
very,
saying,
I'm
Larry?
very familiar with this warming as well. I don't know
Oh,
if
yeah,
y'all can hear
amazing.
me. And
Yeah. So why don't we have Larry continue doing this slide as well, if that works?
I'm familiar with Wells Street Shelter. I'm familiar with the CSO shelter. And I don't know much about that family shelter, but the one over there by these, but I do know they have over there on First
Yeah.
Street.
Yeah. I think it's okay. Don't need to go in depth about each one.
Yeah.
Just that they
Okay.
exist and these are the options.
And that, and that the Wells Street one looks great, but doesn't exist yet.
Yeah, it's growing, it's still building. Yeah.
And the warming center is
Okay.
not classified as a shelter. Just wanna be
Exactly.
clear about that.
Right.
No
It's a
beds
whole
at the
different.
warming center.
Fire chief will be upset about that.
I know, I'm like, it's this is called shelters, but whatever.
Maybe
Yeah,
emergency
there's
assessments or something.
warming
right?
centers are full of- I'm
Larry, we
sorry.
can't
The
hear you
warming
well.
centers are- Okay, all right. I don't know what the hell it is. The warming center is a whole different entity. It's not
Yeah,
a shelter.
Yep.
yeah, I'll rename
put-
this slide to something else.
Or something.
Yeah. Okay. Well, that seems good. And also just a question for my own interest that I realize I don't know the answer to, but if One Arch Place is like the temporary um location for people while the Wells Street shelter is being redone, then what happens once that opens back up to the One Arch Place?
Yeah, good question.
And
I think one of space will be vacant. That's what's gonna, I don't think, I don't know if they
Yeah.
have plans for that, yeah.
because that'd be great as like more winter warming
You could
emergency.
just have two.
Yeah. Okay. I could ask,
More
I
beds,
mean, maybe
right?
just
More beds.
I can ask somebody that question, Kelly, Ben Ezra, just because I'm curious. Okay. I retweaked this slide. I don't know if it's too ugly and confusing now, but basically this one, it's a little ugly and confusing. Sorry. It's a little, basically, the point of this one is that like there's not enough beds in shelters, but then also people don't want to be in shelters for many valid reasons.
There should be two slides there.
Okay, we will tweak this.
Better to have two separate slides that take up less time than trying to over-explain a slide that's confusing.
That seems good. Okay, so we'll come back to this one, but basically like I feel like this is cool data from
Yeah.
2024, like breaking down the actual reasons why shelters aren't appealing to some people and it literally 74% of people are not interested.
Yeah.
That were surveyed, so that's a huge amount. Okay, so Reese and I will break down that slide and then maybe if you wanted to even talk about it, if you were.
I don't feel familiar enough with the point in time count data and process to be a reference point for this.
Yeah. I guess Larry, maybe, do you feel like continuing talking about why some people might choose to continue like being in a tent rather than being in a shelter?
I can share with people who have shared with me. Sure.
Thank
Yeah, I
you.
could do that. I wish Christy was around.
That's true. If she was around, that would be really good. I did reach out to her, but I don't know how she's doing. So
Yeah, I reached out to her too. She hasn't responded, so I don't know. Okay.
yeah, if she's around, that would be amazing. So maybe Larry, but if Christy's not around. Okay. And then
Where's the survey?
now we're back to you, survey.
Okay. Yeah. So I'll talk about the survey. I want to put a picture of the paper form on here. I just haven't gotten to it.
Is this not a big picture?
That's the flyer.
Oh,
The
okay.
paper
Right,
survey.
right.
Yeah. Um. So that's introducing the survey and then this is like demographic results. So who finished, how old they were, where are they living right now? Time unhoused, which is the pie chart, and then all of them named indoor housing as a desire, emphasizing need for safety and stability. And I think this is actually a really nice contrast to the previous slide of like people saying, I'm not interested in a shelter bed, but everybody said they were interested in indoor housing.
Right. Exactly.
And then this is people's responses about what services they're accessing now and barriers to accessing those services. So of the folks who responded, SNAP, Stone Soup, and Wildflower were all named by various folks. Housing and transport were the two most named services that people wanted, but they can't access. And then things that prevent you from accessing services. And I wanted to include this because I think that people often have a sort of association with criminal activity and homelessness, and the things that prevent people from accessing services are stability, transport, knowledge, and availability. And then one person mentioned criminal record.
Mhm.
And
I
then
like the
there's,
graphics.
Thanks.
Dots for people.
It's really good.
and then there should be one more. Yeah. So
This is a great one.
yeah, so we asked how well people think Greenfield serves its unhoused residents, and I gave the numbers of 1 is terrible, 4 is okay, and 7 is excellent, and we had one person respond above a 4.
Yeah.
And everybody else said terrible or okay.
Yeah. Who was that one person? I want to know. What were they getting? What were they
Yeah,
getting?
the most recent person to fill out a survey, actually,
Oh, really?
interestingly. And yeah. Yeah. Anyway, so this, right, there are people recognize that there are services available, but they are not felt as enough.
Right.
I made this a little clearer with your stars too,
Oh, thank you.
because it was hard to see where you were actually identifying.
Thank you.
So do you want to talk about this, or would you like somebody else to talk about this? I feel like you're going to be doing a lot of talking with the legality piece.
I know that's kind of what I
And
figured.
zoning?
I was like, even the intro, maybe I don't need to do the intro either. Like, both.
Like, I can talk about this, you can talk about this, because I would have just been talking about the survey.
Yeah, fair. If you want to keep talking, that would be cool. I'd be happy to talk about this. I would like Christy to talk about this.
Yeah.
But yeah.
That's true. Chrissy was here. This is her slide.
Yeah. But
And the
I'm-
next one,
I'm-
the pictures.
Yeah. I'm happy to talk about this because we spent a lot of time tracing back around their various stages of dampness, so
Yeah, why don't you take this?
sure.
If Christy is available on Monday, I think I agree
Christy's
with you,
absolutely best.
yeah.
For sure.
but so that and then photos.
I was really hard to choose which photos were the most alarming, but those are the two I narrowed it down to.
Oh, I forgot to say, in the community survey slide, I'm gonna say that I added quotes through the rest of the presentation from
Thank
people's
you.
responses.
Thank you.
So this is
Cool.
If you
Yeah,
want
I'm
to-
happy to keep going.
with this. Okay. And then I will like send this back out to us with our names tagged on the slides
Okay.
and with talking, go through it.
Thank
Okay, now I zoning is my.
Take it. Yeah.
As a legislator. So we love Dignity Village.
That's it, that's the whole slide. We love Disney Village.
I mean, I don't know. I don't need to talk about the whole thing because it's honestly a lot of things.
Yeah,
So maybe,
Yeah, I can talk about some of the zoning things that we worked on together.
that'd be great.
Um, maybe you know what, I feel, well, I don't know if this is, do you have the parking stuff in this part or is that later?
Later on.
That's later on, okay. Well, I feel good about talking about parking stuff. I could talk about, trailers and ADUs,
Cool.
because that's like
Your legacy.
Yeah, I was literally going to say, it's my dad's thing. It's all he talks about.
So,
We did talk about that part. So if you want to do this part in the campaign,
cool. I feel good talking about the village model.
nice.
Um. Okay, so I can talk about that. I wouldn't be able to talk about it if it was about campgrounds, but I am allowed to talk about it if it's a new zoning definition.
Yeah, I'm happy to talk about this part. Yeah.
Okay, great. This,
I frankly, if you feel like it's too close to a COI, I'm happy to do all of the zoning stuff. But I didn't want to steal your thunder on the dignity.
yeah, I mean, I don't know. Yeah.
I don't know. I
don't know. We can
What are
figure
you
that out.
comfortable with?
I'm
Okay.
not sure.
Okay.
Oh, why don't we, at the end, we'll like figure out like who has how many slides and
Yeah.
just,
Yeah.
That's a good idea.
yeah. But that sounds good. Also, just as like a side note, this regulating as an ADU, I just called the state. I not called, I emailed because the definition of an ADU is on a foundation. So this is like, but then Great Barrington did it, but then is Great Barrington just doing it illegally
Sure.
or so that's why I'm like just double checking.
And I'm also happy to talk about the manufacturing stuff.
Great. Land unit residential development. Then this example,
Well, if you moved
I might move this.
the Dignity Village to here or here to the Dignity Village, then you could do all of the village model stuff.
Yeah, I think you're right. I think those should be, I should move that. Okay, I do that. All right. Thank you. Good ideas. Okay, now we're in resources. A lot of slides. Are people tired of it? We can make it.
I can talk about this if you want.
It seems good.
Is there, I mean, I don't want to voluntold anyone, but is there any chance Pamela would be up to talk about this? I feel like it's a library project.
Pamela,
I
how do you
could-
feel about that?
I could. What time is the meeting on Monday?
It's at 6 p.m.
Yep, I could talk about that if you'd like.
That'd be wonderful.
Yes, please.
Okay. Sure.
And maybe the map.
Yeah.
Yeah.
You want me to talk about both?
If you're down,
Sure.
nice.
Thank you.
Yep.
Trash removal.
I would so love to talk about this.
Please.
Yay.
Yeah.
Okay.
They still haven't put no barrels down there, did anything different.
Yeah, no, we could check in on this. Like
There's also still a bench missing downtown, like,
yeah.
They haven't did anything.
I talked to Mountain Man about it, and he's willing to communicate to like with residents and be like, oh, this is the day that it's going to be put out and whatnot, and help make sure that that happens. But I think the holdup is honestly just we need to just email and be like, hey, what's going on? Like, I think it's just a nudging. Because it's like
Yeah,
everyone,
I work
What'd
really
you say?
closely with Mountain Man every day. And so me and Mountain Man have been talking about this because there's trash building up down there.
really,
Down there on what they call that Riverside Drive. There's trash building up there down there right now. And so we got to try to figure this thing out because there's nothing that's changed.
yeah. Okay. I can send an email or like I can do this like literally right after the meeting to just make sure that we really get this done because there's no reason that everyone was into it. There's no reason for it not to already be happening.
um,
This is another thing that I wish Christy was here to talk about.
Yeah. If you're gonna talk about the trash, do you want to carry on to
More than
this
happy
line?
to, more than happy to keep talking about this, yeah.
Are you're in the free fridge planning group, yeah?
Nope,
You're not?
no,
Okay.
I'm not.
You and I can connect about that then.
Sounds good. Sounds good.
I didn't really know what to call this bucket, but whatever, right to exist. Seems adequate.
Yeah.
And then Zoe could honestly talk about this.
So we should talk about this.
If Zoe is feeling well by Monday.
I can talk about this if she is not well enough to come.
Okay. Community responders also would be great for Zoe. This is all as Zoe if she can.
And I also feel comfortable to talk about this if she's not. You'll come. But if you, I know this is also one of your hyper interest moments. So if you,
A special interest.
Yes. so if you would like to talk about this, I'm happy to hand it off.
I'm good.
Okay.
But I did love the webinar that I attended. Did you get to attend the webinar, Pamela or Anna? Oh, sorry, you're muted.
She did.
Yes, I did go to the webinar. And so we'll be getting the notes and stuff soon that I can share with the rest of the staff.
Good.
So
Wait,
it was-
I got the slides sent out already.
I wasn't able to go,
Okay.
but I'm planning to watch it.
yeah, I thought it was very informative. And I agreed with you. I like the Lynn.
Yeah.
Anyways, not to get off track.
No, I mean, it's kind of all on this. But and Sarah, I wish Sarah was saying that community EMS could fill a very similar niche.
Mm.
Yeah,
Okay.
they expanded the definitions for the SEMS model. And even if they didn't, we could, a petition to add anything to a SIMS model, or SEMS. So it's doable. And it's out of EMS. It's not out of law enforcement. It's purely out of EMTs, paramedics, and community volunteers.
Does that mean that they would be an option on a dispatch or
It would be the same dispatch line.
it would be the same
And,
dispatch
and they
line?
would just have a separate set of questions to
Yeah.
ask, to tease out. So like,
Great.
I've been developing this on my own as
Yeah.
I'm a licensed EMT. And what I would add to this is peers, similar to the community volunteers from Northampton. I know the Northampton model as well. I've met some of those folks at a public health, but you could have recovery coaches and certified peer specialists who support people in mental health recovery. So essentially, like any mental health or substance use emergency call would be routed to the SIMS team, which would be right out of. And what that would look like would be the fire department would build out a volunteer call force. Because all firefighters are required to be EMTs in Massachusetts, so he already has that, but that's how we could do it, because it has to be attached to an ambulance service or to a service like the fire. And it sounds like there's some like initial support from both chiefs. And it's just, how we look at it. And I think with the state model, we could apply for different kinds of grants for that if it's out of the state model. There's grants at the state level, and there's also the abatement funds in the state level, which also community EMS models can apply
Oh, wow.
for the municipal matching grant, and that's through RISE Massachusetts.
Amazing.
I'm also a grant reviewer with RISE, just want to self-disclose that, so.
Cool.
I would be sitting on any grant that, reviewing any grant that goes through.
What is the grant called?
It's RISE Massachusetts, it's a municipal matching grant, and I think there's one coming in a couple of months. The one that just went out and it's already done with is that the community matching grant? I'll have to look at the schedule of it's public knowledge of the schedule, and if I give that to you, I will when the next opportunity, and just send information to this committee to see what that looks like. But yeah, I love the fact that this committee is talking about community responders, because the community has been asking for that.
Yeah.
And there's really no need for law enforcement to attend to mental health or substance use emergencies, because you can also back me up on that, right? Like, first thing we learn is seat safety. From before you leave with the ambulance, when you arrive on scene, it's not safe, we know to back up and call for, for extra resources. So that's not really a problem. But I hear that a lot when we talk about a model like this, people get nervous. They're like, well, what if, what if? And I'm like, we're trained to know what to do, what if, and yeah, so I love this. This is like part of my hard work.
Oh.
I love that this is part of it.
Yeah,
We also have one of the fire captains is very on board with this as an option.
yeah.
I haven't talked to the chief about it, but
I have
at least one of the captains
Chief
is like,
Strahan a couple years ago, I said, when I got licensed, I reached out to Chief Strahan and said, keep him in the loop.
Yeah.
I mean, obviously he's not gonna say, yeah, let's go for it. He just said, keep him in the loop. He was very interested.
Oh, cool.
So I believe we have two chiefs now that are, are very interested in seeing what this looks like and, see if we can actually accomplish this. I think there's no reason why we couldn't, and
Yeah.
except for the funding. And the only glitch is the funding, because there was a bill in Congress for treatment in place, which would allow EMTs and paramedics to treat in place for folks that have trauma with systems, that don't want to go to the hospital. But also we could do that follow-up, say someone's a diabetic and they're not managing their medication well. And, we did an emergency call with them, we could follow up the next day. Hey, how you doing, Mr. Smith?
Yeah.
How's your glucose today? But yeah, so there's ways about doing it, and I haven't really done a deep dive search into existing money for SEMS in the state level, but I'm pretty sure there probably is. Besides the Rise Fund stuff.
Yeah, I really wish Zoe was here to think about community EMS benefits and then like,
I can talk to Zoe.
Yeah.
We've talked about it.
oh, good, you have already talked about it.
Her and I talked about
Oh,
it.
cool, okay.
Not extensively.
Yeah.
But, that's on my tick list to reconnect with her on this lane and say, hey, can you and I like work together? And I'd love to kind of formulate something with her.
Yeah, that's good.
Considering her background in public health and paramedicine. I think it's a good fit, just
And she was the community EMS director.
yes, she
for the
was.
state,
Yeah.
so that's crazy, that's great.
And the universe is aligned,
Yeah.
I've been talking about this for 4 years now. And it's finally aligned, so
Yeah.
it's wonderful.
Yeah, I'm excited about it. Would community EMS only be volunteer run? Like, would there be paid?
Most likely, because what's the capacity for AMR? Yeah, that's what I said.
AMR is not gonna do it.
No, I didn't think
Well,
you
I mean,
were.
the big thing is we don't bill if we don't transport.
Yes, exactly.
So, and even if we do transport and bill, because of EMTAL, a lot of people just don't pay their EMS bills.
Right.
So AMR is not gonna do this for free.
Yeah, so that's why the volunteer call force comes through. So they're still paid volunteers, but it's a volunteer call force. That's why I think that's why the chief was thinking in that way, because he understood. I mean, I know AMR and their limitations, and I figured they wouldn't be interested in that just because of money.
Yeah.
They have to survive too and be able to continue operations.
Well, they're private for profit, so.
Yeah, yeah, I got you. I got you.
Cool. Moving on from that. Wait, what? Why is it not showing?
yeah, something is a little funky with your.
Oh, it's right. It's just my computer.
Oh, it's your computer.
I
Okay.
forgot.
So
'cause I
there
looked at
are-
my phone and there were labels.
So there are in fact labels on all of those, but Sarah's laptop is doing a thing.
Sorry.
It's okay. Yeah. So success snapshot.
This is all still Zoe.
This is all still Zoe.
Honestly, this is good to know because that means I probably shouldn't screen share on Monday.
Unless you fix your.
Unless I
computer.
fix my computer settings and I don't know how to do that. So
Maybe we can try and.
we can try and figure that out.
Okay.
Or
Yeah,
at least
but it's-
highlight everything.
It's the same slide twice, but with the top 5 categories highlighted. And the reason they're highlighted is because part of what I'm going to talk about when I talk about the survey is what people are asking for. And it's these things.
Yeah. What does DCC stand for?
Division of Community Care.
Northampton one.
Oh, this is.
Yeah, this is the
Okay.
Northampton one.
Okay, gotcha.
Yeah.
Understood.
Yeah, maybe we could even just write Northampton community responders. Whatever. We'll mention it.
Yeah, I mean, this is like basically like resource navigation.
Exactly.
I understand, yeah.
Okie dokie. I don't know.
Okay. Uh,
We all have so many slides because there's so many slides.
that's
So
okay.
is this slide is just basically housing first?
What I think of housing first is like, there's no pre-requirements,
Oh, gotcha.
don't need to be sober.
Okay.
Don't need to have a job first, but then this is more just like upstream as in if renters were able to stay where they live in the first place, then like it wouldn't be as much homelessness.
And in the slide deck, this is the same color as the section heading slides.
Okay,
So this is a section heading slide. It's just using a different format.
If there's a picture.
Yeah, it might be good to,
well, what follows?
What follows is saying like, there's this section of the slides I think could be worked on, because there's no pictures and whatever, but just these are examples of stability measures like rental registry, keeping tabs on health inspections, rent control, housing stability notification ordinance. This one I feel bad fully recommending because they have that in Northampton and like nobody's doing it, but technically a landlord's supposed to give renters' rights materials at the start and end
Mhm.
of tenancy, but it's really hard to enforce.
Mhm.
And then the right to repair is really cool. This is like, if you fix something, like a renter could fix something and then it's just deducted from your rent. And then there's like rules around how that works.
Cool.
But these are sort of like rental registry and these housing stability, right to repair, those are like quality control measures.
so can we play with the previous slide
Yeah.
and the following slides to make them talk to the rest of the presentation a little more?
Yeah, that seems good. Or honestly, even these could be condensed completely into like one slide. I don't know. Or like, I'm not sure how much we want to dwell because I don't know. Like rent control, I think would directly impact homelessness, but then the registry and the housing stability and right to repair, I think it doesn't as much.
Well, let's look at this over the next
Yeah.
couple of days, because I think that there's probably some adjustments that we can make.
Yeah, happy to workshop. We'll come back to this, I think. So maybe we don't need to choose who's saying it just right now. We can figure that out. Affordable Housing Trust. I feel good about talking about this one.
Okay.
Also, short-term rentals don't pay taxes here, and they should. They're just not.
Yeah, I wonder if there's a way to cap that. I mean, it just seems like it's a trend that is eating up some of the housing.
Yeah.
For folks, because a landlord's like, oh, no, I can just make it an Airbnb and make so much more money than renting, long term. And I don't know what the right thing is.
We could literally ban it. That's one option. The other
Make the
option,
tax like completely ridiculous, so they
Yeah.
won't even think about it.
I do feel
But-
strongly that like as a homeowner, like I would like a provision in there that if you are a homeowner and you are doing like an owner occupied short-term rental where it's in the house that you occupy, that it should be like that's one of the only reasons that I'm not homeless is because I have been able to rent part of my house
Yeah.
on like a cyclical basis in a way that then allows me to pay my mortgage. And I know that I'm not the only person in that position, and I think that there are ways to do it that are not like gouging the housing market
Mhm.
and instead bring more people into the town.
Mhm.
Right, because it's folks who are coming in who don't live here, who are coming for like the Green River Fest and the Franklin County Fair and stuff like that.
Two things on that. The most we could ever tax is 9%.
Yeah.
That's the state. That's what it allows you. And there is an exemption for owner occupied 2-family or 3-family, which we should probably do just because no need to whatever.
Because it is a viable income measure, especially like for families who have kids and who especially have like kids with disabilities, or they have additional expenses, or they're, struggling with childcare payments, that kind of thing.
But maybe we would get like 40 or 50,000 a year, and then that
That'd
would
be
be
great.
something that could be used.
Yeah.
So that would be cool.
Yeah. Yeah, I'm like fully in favor of the taxing.
Yeah.
I just don't think it should be banned.
This slide, I feel like I don't have something that I would like to revisit this with you because I know you've worked on this. I don't feel like I have.
Well, this is all. So I made this when we had ordered the whole slideshow completely differently.
Okay,
And now basically this whole section, supply, sustainability and
subsidy supply stability. Yeah.
yeah, like is all things that basically we didn't talk about in this. And they're awesome things that I'm sure would be helpful and that I feel happy about recommending, but they're new. They're like brand new and I had not really even been thinking about them, but
We can just revisit this whole section of the slides. I don't know.
Yeah.
They're all kind of confusing.
yeah, well, I feel like the thing that I put this slide here basically just to make the argument that we do in fact have a shortage of housing in Greenfield, which is like something that a lot of people are not convinced of at this point.
We could also name this as like, there are other groups doing work on this and we are happy to recommend that their work be implemented, like FERCog has been, right? And the People's Budget, I think, has some
Just
stuff.
housing study.
Yeah, so you, like, we don't
Housing
have to
review.
have all the information to still say, like, we put our support behind this.
That's kind of how I feel like is the gist of this slide. It's like,
Yeah.
we're going to focus on stuff that's directly impacting people because whatever, it's a gap, but then there's people working on this.
Well, and also it's a moment to say, like, we're not doing this work alone, right?
Yeah.
Like we've been doing all of this work, we focused on all of these things, and also this is a big enough problem that we are not the first nor the only people trying to like offer a solution here, and they are also worth listening to.
Honestly, I think the main thing that's relevant for us is the housing on public land part, because if like,
Yeah.
if there was like a parking lot or, public land where people wanted to have, put some tiny homes up or like that would, you could lease it to a nonprofit and the nonprofit could do it, or I don't know. I mean,
Well,
that's
that
the
is-
part that's relevant to us.
Yeah, and
That's
that's-
more the village model thing.
But that's also something that we did, like,
Yeah.
you know, you and I went and walked a bunch of different pieces of land, and that's worth saying. Because there is land that would be great if you would just say yes, you know?
Right. Yeah. Okay, well, we'll tweak it. So next steps, wrapping up. This is good. We have like 5 or 6 slides left, I think. I just was thinking, like, if anyone's watching and they're like, wow, I'm moved. I want to do something. Like,
Here are the things to
then they
do.
could do something. That's not.
I like that.
But are there other ways that people want to, these are just things I was brainstorming, but I'm sure there's other things. Like, would Wildflower Alliance want cash donations, Larry? Or like, do you feel like Interfaith Council, like who do you think is the best, or direct cash assistance if people know somebody and there's a specific thing, but like
The Interfaith Council.
is the best for funds?
The Interfaith
Wildflower's not
Council.
on here right
Yeah,
Oh,
we don't
wait.
really take cash. We don't really take. I mean, I guess you could probably do it, but we ain't really
Yeah.
taking too many cash donations.
Would
But we do take regular donations though, and we're on Chapman Street, so folks walk up and down Chapman Street every day. We get
Would you-
we get a crowd of people all the time, Monday, Wednesday, and Friday.
would you want Wildflower Alliance to be listed as like donating supplies that are good for
Yeah.
camping? Okay,
Yes.
so because right now we have Registro, Mountain Man.
What is
And then
food, gear, and goods?
I was thinking food like for the free fridge, but I'll just take that off. We don't have it yet.
Well, it's out of alignment with the rest of
Yeah,
your
it's true. It's not a
naming
specific thing.
practice here. Is gear and goods a thing, or is
Yeah, so
that?
it'll be a task force every year. They do a
Okay.
care goods drive.
Got it.
Yeah.
But the gear and goods drive, like they wanted a lot of really specific
Yes.
things.
Mm.
Tents, jackets, Yeah, that's why it's called gearing goods.
Okay, I'll
Yeah,
write,
that's because of our past experiences. When we having that gear and good drive, sometimes folks will donate stuff that the first year we did it, we had to end up re-giving that stuff to other places because a lot of that stuff wasn't we couldn't use. So now we try to have more specifically directed stuff that we try to get for folks.
right,
And can I ask,
yeah,
the 911 usage point?
somebody added that, you added that? Who added that?
Yeah, I added that one.
Okay, I was like-
I wanted to ask you if that's a current problem.
It is a huge problem. People will call 911 for anything in this field.
Yeah,
Yeah, sorry. Yeah. that's
you're
all I
like,
got.
you wanna soapbox this right now?
If you just show them that, I don't know if anybody's seen there's a firefighter, Fenton, that has a song that he releases every year at Christmas, like, the reasons not to call 911. It's pretty funny, like my partner won't talk to me. 911. It's done to like a Christmas song, so that kind of reminded me when I saw that. And,
It gets that bad.
Yeah, well, I think it's relevant in Greenfield because we have an epidemic of people calling 911 on someone for being homeless.
yes.
Like, it's just like they see someone on the street and they call 911.
So
You think
that
that
is not what I
explicit in
get
this?
from that point, and I think that that's worth saying in a more explicit way.
Sure.
And, but also like be considerate is, don't call 911 on somebody because they don't have a place to sleep, but also like think about how you relate to other human beings who
Yes.
happen to not have a place to sleep.
Yeah. I think that makes sense.
Yeah.
Um,
Okay.
So tweak what that says.
Yeah.
And then also I'll add links to all of these, because that way,
Yes.
then once these are
Yes.
in the public on an agenda, then people could like click and like email or sign up or whatever.
Great.
But I didn't do that yet. Okay, so and I'll write gear and goods drive, like opioid task force, so it's clear. Link to that, or just link to
And
it.
if you're linking, then you can take off free store and have space to put in something else.
Yeah, I could just write registrar.
Yeah.
That's good. Thank you.
Stickers. Thank you.
And then inventory surplus, I feel a little weird about that one. But like if you live in a big house alone, like, or if you have backyard space or like, I don't know, like, is that one's like a little bit critical of
think-
people's lives, but it's
No, I think
just-
you should put that there.
I think we're being a little critical here, and I think that's good.
Okay, I'm like, if you have space, there's
And also
people
this
who-
is a nice long list, like people don't have to do them all.
That's true.
Yeah, that's a good point.
Okay, great. So we don't feel that it's crossing over,
No.
overstepping.
Hmm.
Okay, great. Wait, who's saying this stuff?
I'm happy to say this stuff.
Thank you, Robin.
Great.
So we will come back to figuring out the supply, subsidy, stability, our narrative there, and who's saying them. It's kind of confusing. These are horrible notes, but I'll figure it out after. And then next, the checklist, and then the slide I added at the end. Maybe just to show. I added two more. These are the two I added, just because I don't think you guys saw them yet.
No.
So this is the checklist,
Yeah.
which is a recap of everything. I don't think there's anything new. But at the same time, Max was like, there's new terms on this slide. I was like, what's a new term? So I don't know, maybe it still looks confusing to people.
Trespassing.
Trespassing, you feel like, what's-
I don't know that we've talked about.
Yeah, where did the ordinance slide happen?
It
The
was-
ordinances were there, but
The trespassing was on there, but I can
Trespassing was
like
on there.
highlight it, or, because maybe trespassing. I think it maybe got lost.
no, and I think, and like enforce short-term rental tax is a little bit different wording than was on the.
Yeah, so I think
Slide.
just make sure I match the wording.
Yeah,
so
but
people-
most of it's the same.
Yeah.
Okay, like it is all the same, but I think the wording
Yeah.
wasn't exactly the same, so I'll just make that match, so you hear it twice, repetition is key. So then this was just what I was thinking, and then this is a good thing for us to transition to now that we're almost at the end anyway, but so right now we're in this phase, we're presenting. It's not a flash in the pan, we're like just starting setting the stage for these ideas, and then we still gotta like bring these ideas around recommendations to city departments, like central maintenance. Can you do a 24/7, 365 year-round water fountain? Like, what would that even cost? Like, we haven't had those
Yeah.
conversations yet.
Can we adjust the language?
Yes,
So rather than saying get additional feedback from,
Yeah.
can we say something like develop partnerships with?
yeah, collaboration.
I'm less interested in getting feedback and more in saying, we're ready to work with you. Here's what we'd like to do. How can we make this happen?
Okay. That seems reasonable, because I feel like we already did
Yeah,
do some preliminary
yeah.
whatever consulting and meeting with people, but this is now the stage of like, okay, what would it really do? And then hosting a public hearing. I like the idea. Improve collaboration with, I think Lisa's talking about step 2, like the city departments,
Yes,
boards and commissions, mayor's office,
yes.
service providers, community groups, and house community members.
And the public hearing, the purpose of the public hearing would be what?
I think a little bit of like an in-between step, like we could just be like, here's our zoning changes, here's our ordinance changes, but then also we have other recommendations that are not strictly legislative, and then this would be like, we could even get pizza or something, like it could be a little bit more of like a social event. And
Sorry, so the reason I'm asking is that if step 3 is host a public hearing to share legislative recommendations with the community,
not just, I think all of our recommendations, like I don't think we're really gonna have a big turnout Monday night, but basically like
Right.
it's a way to like actually get people tuned in.
mostly I'm thinking if step 2,
Oh wait, yeah, okay, let's have something.
yeah. If step 2 needs to actually be like develop implementation plans
Yeah, I think that's what
in
step 2
partnership
is.
with these, because then step 3 is like, here is our plan. What do you think about this?
Yeah,
Um,
yeah, thank you.
yeah, Pamela.
Okay, you may have answered my question because I was gonna ask if the hosting a public hearing is just to present or to ask for community recommendations or community input.
Yeah, that's exactly what I was just sort of saying is like,
Okay.
is the public hearing to say, here's what we're doing, tell us what you think? Or is the
Yeah.
public hearing to say, we want to know what you think we should do? Like, both of those would be very different. And I think the public hearing could be, here's what we think we should do. And we have these recommendations in partnership with all of these city agencies, and now we're ready to like sort of get a final like rubber stamp from the community, essentially.
So can I ask a
Yeah.
question? Because, when I see public hearing, we have to follow open meeting law. So you have to, have it posted and official and have public comment
Right,
as part of the public
Mhm.
hearing so that you can hear from the public. That was one of the things, because I heard it was a very casual kind of conversation about the public hearing. I was like, well, wait a minute, that has to be,
yeah.
follow the open meeting law.
I know, honestly, like what I'm wanting, and I don't know how to do this in the structure of meetings, because I don't necessarily want like presentation, public comment, like I would love if it was like pizza, homeless and housed community event, and like people can be like,
Sure.
that would be
You want to
more,
have a community discussion?
yeah, I feel like that would be more, like we could also go through the recommendations, but maybe not this level of.
Are we allowed to do that?
I don't know.
Can you find that
Or
out?
maybe we could be if it was hosted, like Housing Greenfield
I was
was.
gonna say, if there's not a quorum.
Yeah, exactly, if it was.
Yeah, I would definitely consult Kathy Scott on that
Yeah.
for clarification.
Like,
So-
I don't know, both of those things sound valuable,
Yeah,
right? Like, they're very different
Mm.
purposes. So like maybe the getting in deeper relationship with other groups involves having some community discussions that are led by other community groups like FERCog,
Mm.
or Housing Greenfield. And then the public hearing is the official thing.
Yeah.
Right? And that is the preliminary step to actually bringing it to city council.
Or you could do that as long as there's not a core of members.
Yeah.
You could do that. You could do, just like you said, as long as there's not a quorum.
Well, I'm thinking about in step two. Right,
Oh,
as part of
yeah. Oh,
step two,
yep,
other
yep.
community groups host things where there is not a quorum present
Mhm.
and at least one of us is there being part of the conversation,
I
like,
love that.
because that would then follow, that would put that like community feedback higher in the process, which I feel more comfortable with.
Okay, I see.
Right, because then we're actually in conversation with community before we're ready to make any formal recommendation. And then by the time we're hosting a public hearing, we show up hoping, right, that we've heard a lot of the feedback already and then can move a little bit more easily.
Yeah. Also, public hearing doesn't need to be separate from bringing legislation forward. Like,
Yeah,
anytime you do that, it's like the public hearing is open, now it's closed. Like, it could just be in the meeting itself. It doesn't need to be a separate drawn out
and as long as we're having like
association.
real conversations in step two, then I think that step three and step four could be the same thing.
Cool.
Because then, again, hopefully we would have had enough conversations with enough different demographic groups of people that by the time we bring it to city council, we're getting people standing up in public comment and saying, I've heard about this already, I've been in conversation with these people and I approve it and it's it by town.
Yeah.
And if we have 30 people do that and, then 4 people who are like, I haven't heard anything about this, that would be an ideal outcome,
Yeah.
I think.
I think people's least favorite one is going to be tiny homes as an ADU.
Yeah.
Because ADU is a trigger word.
Yeah.
And it also is not even gonna, I think we could let that one go if people really don't like it, because Great Barrington, they said they don't, like, they passed that a few years ago and they said that nobody's applied for the permitting, because it's already really complicated to like adhere to building code appendix Q for tiny homes.
Mhm.
So I think I'm not gonna die on that hill if people don't like it. But
That's
we'll
also
see.
part of the like having a really robust set of recommendations means that if you have to let 1 or 2 things go,
Yeah,
you're not then feeling like you've lost the point and purpose of the whole process.
right, like what feels most
Yeah.
doable. So Lisa, are you down to workshop these and revise it?
Yeah, sure.
Okay. Okay, so we're in this timeline process. I was thinking like, we're here December, I was thinking the implementation, this is all like January, February, I don't know. We could
Are
break.
you on a new slide? Sorry.
Oh, no, I'm on the same slide.
You're on the same.
I'm saying like for step 1, that's like now, yeah, step 2, it's also now in December, but more thorough in January. And maybe we'll try to bring something forward in like February, who knows? Does that seem reasonable?
I think that we should give ourselves the first quarter
Okay,
for step 2.
yeah, that seems good. The one thing I'm worried about is I don't want to line up with budget season, because if we're doing budget season, then nobody will have the brain space or will want to.
When is budget season?
I think it'll start like April, when did we approve it? May?
Okay, so if we give ourselves the first quarter
Yeah,
and with the idea that at the end of the first quarter, we're presenting to the city council,
yeah,
that would be March. Right? End of March.
March is about the time that the budget really starts to pick up, so you want to be done by March.
Okay, so what if we gave ourselves until mid-March to present to the city council? Earlier being better.
then things have to have like multiple readings for zoning, so then it's still syncing it up with budget season. We can figure it out, I guess, how long it takes us to do all this feedback. It's okay if we don't.
I think that we could do it. I think that if we want to aim for beginning of March, we're gonna have to.
I think we should aim for earlier, is like February.
But what I'm saying is
Yeah.
even if we are aiming for the beginning of March, that's 2 months.
Yeah.
Right? So it would be tight. I
Yeah,
think that we would have to have a really clear timeline and really clear like division of labor, because otherwise it's not gonna happen.
yeah, this could be another meeting in and of itself, I think, planning our public outreach strategy plus the implementation, who's talking to who, and think maybe that's,
Like, I think we can do it. I think it's just, I don't know. We can't be lax about any part of that if we want to be
yeah,
wrapping this list up in 2 months. Because we're gonna have less than 2 months, and February is a short month.
right.
Because nobody's gonna be back to doing stuff until January 4th-ish.
Okay. Um, I'm okay to just, try and map this out in our next meeting, if that seems good.
Instead of presenting it as a slide, you know?
No, I mean, I'm happy to put it in the slide, but like leaving it vague as in step 1, step 2, step 3.
Oh, no.
And like not
Having an
having
internal timeline.
and
for us,
internally,
yeah.
let's map out our own timeline.
Yeah,
That sounds good.
yeah, I like that plan.
So then who's presenting this slide?
Reese, you sound like,
I can present the slide. Sure, I know what I'm talking about.
okay, these are the ones I added next, I think. That one and the end. So I added this one just as like zooming back out. Why are we doing anything at all? And I found this community solutions built for zero group that seems really cool. They have like 15 communities that have like functionally zero homelessness, and what they're describing that as is homelessness is rare, brief, and not chronic, and that the number of people that are entering homelessness, then there's still a rate of people getting rehoused. And so it's not like that people aren't becoming homeless, but just like it's like a dynamic
Yeah,
rate, and people are frequently getting help getting housing enough that they're not. And that they track it like in real time by name data. And I don't think that we have that. Like the point in time count is data. Like people have that internally, like Larry has that knowledge, but like I don't think that it's not a coordinated enough effort between all the different providers and people working on this issue. So I think that this could be a pool to be like a local community participating in this program by Larry.
Yeah.
Thank you. I feel like that,
can we put this before the last slide?
yeah, totally. I don't know where we want to put this, but
No,
I
I
feel
mean,
like,
can we put it one slide up?
oh yeah, sure. But I like the idea of like, we're part of a network of people working on this, and people can have like more quality of life and more dignity.
And are we saying should join Built for Zero, the city of Greenfield?
City of Greenfield. I
This
guess,
is another recommendation.
yeah,
Yeah.
it's another recommendation.
Okay.
It's a new one. I just found it today and I was like, this is so cool.
Can we put it one up, and then maybe we can go back and rework it into one of the municipal?
Yeah, checklist.
Yeah.
That seems good. And honestly, there was like there was a quote from them about like how homelessness is just a bellwether of our systems for community resilience, which I liked. But yeah, we can work this in because it's not totally, yeah. Or we could even go at the beginning. It's like our guiding principles, and then like this is
I
something.
like that. I
we want
like that
to-
better.
I like that too, but it was not part of our goal.
No, it wasn't.
It can be part of our goal now.
It was inclusion of the unhoused community was our.
Right.
Oh, wait, also I think we're not supposed to talk because maybe we're less than a quorum now. I think we're 3.
I don't think it should go at the beginning, because it wasn't part of our vision.
If you don't have a quorum, you have to,
I think we have to wrap up.
you have to end the meeting, yeah.
Sorry.
Kevin was
Sorry,
not
everyone,
one
I
of
just
us
remembered we
yet.
have to wrap up the meeting. We don't have a quorum. We will do that. So, but we will stay in touch, and I will send out the slides with the names. So can I have a motion to end the meeting?
Move that we end the meeting.
Second,
Thank you. All in favor?
aye.
Great. The
Without a
meeting.
quorum.
The meeting is ending, and it is 4:37 p.m.
Thank you.
Thank you,
Thank you all.
Pamela, and see you on Monday.